Hi everybody, I'm Naufal. Welcome to my channel. Today we are going to discuss regarding principles of mental health nursing. Okay, the general principles of mental health nursing. We can see one by one. Okay, first one is patient is accepted exactly as he is. Patient is accepted exactly as he is. That means accepting the patient exactly as your client, exactly as your patient. Accept the patient. So for accepting, you should be non-judgmental. Acceptance means you should be non-judgmental. Don't judge the patient. Don't be a judge. You are a nurse. Okay. So judgmental means you are judging your patient. This is a criminal. Your patient is a criminal, or your patient is a murderer, or your patient is a thief. He will do like this, he will do like that. Don't judge the patient. Accept the patient. Accept the patient as he is a client. He is a patient. He is your patient. How he was, don't judge. How he is now, he is your patient. Okay, so being non-judgmental, that is, don't judge the patient. Avoid the prejudice. Okay, accept the patient. Don't think your patient is a criminal or your patient is a murderer. He is your client. He is your patient. So accept the patient. The first thing of acceptance is being non-judgmental. That is, don't judge the patient. The second thing how to accept is being non-punitive. Non-punitive means don't punish the patient. Okay, physically and verbally don't punish the patient. Physical punishment means you are beating the patient and you are chaining the patient, or you are putting the patient in a room and locking that room. That is physical punishment. So don't punish the patient. And verbally, don't shout and don't scold the patient. So accept the patient as your client. Accept the patient as he is your patient. Don't judge, don't punish, and being sincerely interested in the patient. So show the sincere interest in the patient. That means talk to the patient. You have to talk to the patient, listen to the patient, and allow the patient to take decisions. Allow the patient to take decision. Be honest with the patient. Okay, and while the patient is communicating to you, keep it in mind, the topic is not important regarding the feeling behind the communication. What is their feeling? If they are communicating to you, the content or the topic of the communication is not important, but the important thing is their feelings behind that conversation. Their feeling may be sad, or it may be fear, or it may be anxiety, or it may be happiness. So identify the feelings behind the communication. Okay, as well as listen properly. Let them talk. You should be a active listener. All these things shows the acceptance of the patient and allow the patient to express the strongly held feelings. Allow the patient to express the strongly held feelings. So many feelings will be there inside the mind of the patient. Allow the patient to express that feelings. For example, anxiety or the fear or the anger. Let them express. Okay, let the psychiatric patient express their feelings. That is the way you can show the acceptance of the patient. Okay, let them express their fear or anxiety or the any feelings, happiness or the anger, any feeling, let them express. So first principle is patient is accepted exactly as he is. Accept the patient as your patient, as your client. Don't judge the patient, don't punish the patient. Show a sincere interest in the patient. Listen to them while they are talking, and while they are talking, the topic is not important. The important thing is their feelings in the communication, as well as allow them to express their feelings. All these things shows the acceptance of the patient. That is the first principle. Patient is accepted exactly as he is. Next principle is use self-understanding as a therapeutic tool. use self-understanding as a therapeutic tool. Suppose if you are a psychiatric nurse, okay, so you should understand yourself. The nurse should understand herself, that is understanding regarding the strength, understanding regarding the limitation of the nurse. If a nurse is ready to understand regarding the strength and limitation of herself, then only she can understand regarding the strength and weakness of the patient. First, a psychiatric nurse should have a self-respect and love yourself. Then only you can respect others, and then only you can love others. Okay, so use self-understanding as a therapeutic tool means, first of all, the psychiatric nurse should understand self. This is my strength. This is my physical strength. In my psychiatric knowledge, this is my strength. In my skill, this is my strength. And regarding my weakness, suppose for a psychiatric nurse, she is having anxiety. So that anxiety is a weakness of that nurse. So she should understand, she should accept that I have the weakness of anxiety, and my strength is my physically I am fit, and I have the psychiatric knowledge, and I have the skill to do the procedures, but I have anxiety. So the nurse is understanding herself, she is respecting that, she is loving that. Then only the nurse can understand the strength of the patient as well as understand the weakness of the patient. Okay, that is use self-understanding as a therapeutic tool. Okay, understanding self first, then you can understand the patient. Clear? Next one is consistency is used to contribute to patient security. Consistency is used to contribute to patient security. So consistency should be there. The third principle is related to consistency. That means consistency means regularity. A regularity in the routine of the hospital and the regularity in the behavior of the nurse should be there in the psychiatric nursing. That is, every day you have to follow a same routine. For example, regarding the time of the medicine, regarding the time of the food, regarding the time of the bath, regarding the rounds of the doctor, regarding the time of the sleep, everything there should be a routine. Don't change that routine every day. Okay, you have to follow that same routine. So the patient will adapt to that routine. Frequently, if you are changing the routine, they will be confused and anxiety will increase. So you have to maintain a consistency in the routine as well as the behavior of the nurse. The behavior of the nurse means one day you are talking to the patient as well as you are cooperating with the patient and you are smiling to the patient. Next day you are not talking to the patient, you are not cooperating and you are showing angry to the patient. That is also consistency is not there. So in the behavior of the nurse also you have to maintain a consistency. That is a regular routine. Don't change it. It should go perfectly. Okay, don't change in between. In between you are changing. Today you are telling you can sleep at 8 o'clock. Tomorrow you are telling don't sleep at 8 o'clock, you have to sleep at 10 o'clock. So the psychiatric patient will be confused. It will increase their anxiety. So consistency is used to contribute to patient security. Patient will feel a secure feeling by consistency. Consistency means regularity. Regularly you are following a same thing. That is consistency in the routine of the hospital as well as the behavior of the nurse. Okay. Next one is reassurance should be given in a subtle and acceptable manner. Reassurance should be given in a subtle and acceptable manner. Okay. So what is meant by reassurance? Reassurance means you are providing confidence. It should be given in a subtle and acceptable manner means it should be given in a clever. You have to use your brain. It should be given in a clever and a acceptable manner. Providing confidence to the patient, you have to use a clever and a acceptable manner. I will give you one example so you will get a better idea regarding what is reassurance. Okay, suppose if your patient is asking regarding discharge. Okay, you are working in a psychiatric ward and your patient is asking regarding the discharge. So you are telling, if you take this medicine, I will give discharge for you. After 1 hour, I will give the discharge. That is false reassurance. That is false reassurance. Don't give false reassurance. Reassurance means, with the same example, if your patient is asking to you, I want to go to my home, give me discharge today. So what the psychiatric nurse is telling? She is telling that if you follow this treatment, your condition is better now. Okay, now your condition is very good, your condition is improving, and just follow this treatment. If you follow this treatment, you will get discharged soon. Just follow it. Just take the medicines now. Don't think about the discharge now. Soon you will get, if you follow these routines. So reassurance should be given, but don't give a false reassurance. Okay, providing confident should be given in a subtle, that is using a clever as well as the acceptable. The patient should accept it. If you are giving a false reassurance, means they will lose the confidence. Okay, provide the confidence, that is reassurance. It should be provided in a subtle, that is in a clever and a acceptable manner. Clear? Next one is, patient's behavior is changed through emotional experience and not by rational interpretation. Patient's behavior is changed through emotional experience and not by rational interpretation. That means, in psychiatry, okay, in psychiatry there is no use of advising. You can't change the behavior of the patient through advising or using the sense. You can't change. You can't change the behavior of the patient through advising. Only you can change the behavior of the patient using emotional experience. For example, if your patient is alcoholic dependence and you are advising the patient regarding the problems related to alcoholism and regarding the problems creating in the family related to the alcoholism, as well as regarding the problems of the alcoholism and how it is injurious to the health, you are advising, but it is of no use. Okay, you have to provide the emotional experience. Emotional experience you can give through role play and through socio-drama. You are acting. What are the problems of the alcoholism, how it is affecting the health, how it is affecting the family, how it is affecting the social life, and how it is affecting the job. You are acting and showing to the patient through role play as well as through the socio-drama. You are providing an emotional experience. It will help the patient to change the behavior, but advising will not change the patient's behavior. Clear? That is, patient's behavior is changed through emotional experience and not by rational interpretation. Patient's behavior can be changed through emotional experience, that is through the role play and the social drama. You can act and try to understand the patient, provide an emotional experience, but not by rational interpretation, means not by the advising and using the sense. You are continuously telling don't use alcohol, such problems will occur. That advice will not help the psychiatric patient to change the behavior, but emotional experience will help to change the behavior. Clear? Next one is, unnecessary increase in patient's anxiety should be avoided. Okay, unnecessary increase in patient's anxiety should be avoided. For example, already the psychiatric patient will be having anxiety. Most of the psychiatric patient will be having anxiety. Okay, so unnecessarily again you are trying to increase the anxiety. That should be avoided. For example, in front of the patient, the nurse is showing her own anxiety. You are showing your own anxiety in front of the patient. So again the anxiety of the patient will increase. And if a patient can't do a thing, he can't achieve a goal, so you are repeatedly forcing them. You are repeatedly forcing them to do that. It will increase the anxiety of the patient. So unnecessarily increasing in the anxiety of the patient should be avoided. Clear? Already the patient will have anxiety. Again, you are trying to increase the anxiety. You have to decrease the anxiety of the patient. Don't try to increase the anxiety of the patient. If you show the anxiety in front of the patient's anxiety will increase, as well as if you are forcing them, definitely they can't reach or they can't achieve that goal. Then also you are forcing them to complete that goal. So the anxiety of the patient will increase. Okay. The next principle is objective observation of the patient to understand his behavior. Okay. Next principle is objective observation of the patient to understand his behavior. Okay. So objective observation of the patient to understand his behavior is the next principle. So objective observation means evaluating exactly what the patient want to say. Evaluating exactly what the patient want to say, that is objective observation. Okay. Evaluating exactly what the patient want to say and not mix it with your feeling. Suppose if your patient is depressed patient and he is trying to talk regarding his financial loss, okay, but you are evaluating he is trying to talk regarding his family matter. That is wrong. That is not a objective observation. Objective observation of the patient to understand his behavior. So to understand the behavior of the patient, objective observation is required. But objective observation means evaluating exactly what the patient want to say. Okay, what the patient want to say. Don't mix it with what is your feeling. Okay, this patient is going to talk regarding that. Okay, don't mix it with that. You have to observe what the patient want to say, exactly what the patient want to say. That is objective observation. Okay. Next principle is maintain realistic nurse-patient relationship. Maintain realistic nurse-patient relationship. Okay, so maintain realistic nurse-patient relationship. That means maintain the professional nurse-patient relationship, not the personal relationship. Next principle is maintain realistic nurse-patient relationship, means maintain a professional nurse-patient relationship. Okay, so in nurse-patient relationship, the important thing is focus on the, you have to focus on the emotional as well as the personal needs of the patient, not the emotional and personal need of the nurse. Okay, maintain a professional nurse-patient relationship. While maintaining the professional nurse-patient relationship, you have to, the nurse should focus on the, what is the personal need of the patient. Okay, what is the personal need of the patient, as well as what is the emotional need of the patient, whether he want to express his feeling, he want to cry, or he want to express his anxiety, or he want to express his fear. Okay, you have to focus on their emotional and their personal need. What is their personal need, not the personal and emotional need of the nurse. So maintain realistic nurse-patient relationship means maintain a professional nurse-patient relationship. Okay, next principle is avoid physical and verbal force as much as possible. Okay, next principle is avoid physical and verbal force as much as possible. Okay, avoid physical and verbal force as much as possible. Okay, avoid physical and verbal force as much as possible means physically don't punish the patient, don't beat the patient, don't chaining the patient, or don't put the patient in a room and lock the patient or restraining the patient. That are the physical punishment. Physically don't punish the patient, don't beat the patient, it will not change their behavior. Don't restrain the patient or don't lock the patient in a room, as well as don't put the chain, okay, that things are physical punishment that should be avoided. As well as verbal force or verbal punishment means you are scolding the patient, you are shouting the patient, it should be avoided. Avoid physical and verbal force as much as possible. Okay, avoid physical and verbal force as much as possible. Next principle is nursing care. Okay, nursing care is centered on patient as a person, not on control of the symptoms. Okay, nursing care is centered on patient as a person, not on control of symptom. Nursing care is centered on patient as a person, not on control of symptoms. Okay, so nursing care is centered on patient as a person, not on control of system. Okay, according to this principle, nursing care is centered on patient as a person and not on the control of the symptom. For example, in medical surgical, okay, if the case is malaria and the two patients are there in your ward, two patients are there, and these two patients have malaria and they have fever, the symptom is fever. Okay, now their need is they want to get relief from the fever. Okay, their need is they want to get the relief from the fever. Okay, so here in psychiatry, in the same example, two patients have depression, the symptom is same. For one person, the reason of the depression is financial loss, and for another person, the reason of depression is love failure. The symptom is same, the symptom is related to the depression, but the need of the patient is, one person need financial support and another patient need psychological support from the family. The need is different in psychiatry, even though two patients are showing the same symptom, but the need of the patient will be different. Clear? In the medical surgical, for fever, both of their need is they want to get relief from the fever, but in depression, two patients are there, but their need is different. One reason for the depression is financial loss, and for another it is love failure. So their need of the patient is different. Okay, so according to this principle, two patients showing same symptom, but their need will be different. That is, nursing care is centered on patient as a person, not on control of symptom. Okay, you are not centered on control of symptom, you are centered on patient as a person. So for that person, what is the need? You have to identify that. What is the personal need of the patient, not the control of the symptom. Clear? Next principle is all explanation of the procedures and other routines are given according to patient level of understanding. Patient level of understanding. Okay, all explanation of the procedures and other routines are given according to patient's level of understanding. Okay, all explanation of the procedures and other routines are given according to the patient level of understanding. That means don't think that this is a psychiatric patient, no need to explain regarding the procedures and routine to the patient, he will not understand anything. But the principle of psychiatry is you have to explain the procedure, you have to explain the routine according to their level of understanding, how they are understanding according to their level. You have to explain the procedure and you have to explain the routine. If they are not understanding, tell 10 times or 100 times, but you have to explain it according to their level. You have to explain how they will understand. According to that level, you have to explain. Clear? And the last principle is many procedures are modified. Many procedures are modified, but basic principles remain unaltered. Remain unaltered. Okay, the last principle, many procedures are modified, okay, but basic principles remain unaltered, which means many of the procedures are changed due to the development of the technology. Due to the development of the technology, many procedures are changed. Okay, different machines are there to do the procedure, but the basic principles remain same only. It will not change. For example, safety of the patient, comfort of the patient, privacy of the patient, it will not change. It will remain same only. The procedure will change. Okay, according to the development of the technology, the procedure will change, but the basic principle will not change. For example, safety of the patient, comfort of the patient, and the privacy of the patient, it will not change. Clear? That's all regarding the principles of mental health nursing. We will meet soon with another video. Till that, thank you and goodbye.